Health needs of Hispanic and Latino community in Florida. Introduction. The state of Florida is characterized by a great variety of ethnic population groups which compose its demographics. Resembling a nationwide trend, this state's residents include many immigrants, a large part of which come from the countries of Latin America. Therefore, a significant part of Florida's population is occupied by Hispanic and Latino populations. When assessing community health needs, one should include the considerations concerning the health-related issues that this population encounters. Thus, it is essential to analyze the community's health concerns and their determinants to provide an evidential basis for further improvement program implementation. Since Hispanic immigrants deal with challenges related to adaptation to a new environment, they tend to use alcohol and engage in risky behaviors, which adversely impact their health. In this paper, the health needs of the Hispanic and Latino community in Florida will be assessed based on the demographic analysis, primary health issues identification, and determination of population groups whose needs need to be addressed. The assessment is carried out based on data retrieved from recent scholarly articles and official health needs reports. Demographic characteristics of the state of Florida. Florida's population is comprised of individuals of diverse ethnicities, races, socioeconomic statuses, and cultural and spiritual backgrounds. As the U.S. Census Bureau states, the total number of citizens in Florida as of 2018 is 21.3 million individuals with a median age of 41.8 years and a median income per household of $50,900. The demographic representation of the ethnicities of the population is as follows: 11.1 million white non-Hispanic citizens, 3.3 million African Americans, Asians, 543,000 citizens, and around 5 million Hispanic or Latino residents. The demographic data indicates that Hispanic and Latino ethnicity is dominating in number among all other minority groups. In particular, it constitutes just under a quarter of Florida residents. Therefore, it is vital to address the health needs of this community specifically. Health-related patterns across the community. According to the Central Florida Community Benefit Collaboration, the state of health in a community is determined by the physical, mental, environmental, spiritual, and social well-being of all community residents and is highly impacted by their cultural background. The trends in health problems show that the main physical illnesses experienced by Hispanics in Florida include heart disease, cancer, diabetes, and HIV. Also, it was found that the Hispanic population demonstrates the lowest insurance rate out of all ethnicities in Florida, as well as high rates of birth mortality and morbidity. Latino immigrants are exposed to mental health problems caused by environmental, sociocultural, and spiritual factors which lead to acculturative stress and substance abuse. Alcohol use is regarded as the primary issue of concern for the characterized population due to its adverse outcomes for both mental and physical health. Population groups impacted by the identified health concerns. For full-scale high-quality community health needs assessment, one should incorporate the influential factors determining the health concerns for a particular group with the outcomes to find an effective solution for the identified problems. In the case of the Hispanic and Latino communities in Florida, alcohol abuse is regarded as an issue that stems from stress imposed by sociocultural difficulties adapting to a new society and increases the risk for sexually unsafe behaviors, HIV, and STDs. The population groups impacted by these health concerns include young Hispanic men and young Hispanic women with low income levels who have recently immigrated. Alcohol consumption is a significant facilitator of mental and physical illnesses. As the study by Ertl et al. Found, young adult Hispanic women who used alcohol were more likely to experience acculturative stress, anxiety, and depression. Moreover, excessive substance consumption was identified as a leading factor for engagement in risky sexual behaviors. Interestingly, the rates of alcohol use are closely related to HIV risks. This tendency is crucial to address in healthcare programs because on a nationwide scale, Latinos, who comprise only 17% of the U.S. population, account for 21% of all new HIV infections. Latino women are the population group that is disproportionately exposed to HIV risks, which ultimately leads to an increase in morbidity and mortality rates. Therefore, it is vital to eliminate alcohol abuse and related sexual risk behaviors to reduce HIV rates among the Hispanic population in Florida. Conclusion. In summary, the Hispanic and Latino community comprises a significant part of the population of Florida. The primary health concerns of this population group are essential in community needs assessment due to their impact on the health of the whole nation. The identified health problems among young Hispanic men and women include HIV, mental disorders, and related complications caused by substance abuse. It was found that socioeconomic and cultural factors were decisive in the population's engagement in alcohol use and unprotected sex, which are primary contributors to HIV risk. Therefore, it is necessary to develop a program of culturally sensitive interventions to meet the health needs of Hispanic citizens in Florida.